What are the surprising origins of anti-vaccine movements? Imagine a time when people debated not just about health but about the very idea of government control and personal freedom. The anti-vaccine movement did not start with modern skepticism or social media. It actually began long before vaccines existed, rooted in fears, beliefs, and ethical concerns that still influence debates today. Back in the 1720s, when doctors practiced variolation to prevent smallpox, religious leaders opposed it. They believed diseases were divine punishment for sins and that trying to stop them was sinful or even diabolical. This religious opposition set a pattern of resistance that would last for centuries. When Edward Jenner created the smallpox vaccine using cowpox in 1798, opposition was quick to follow. Even though some leaders like Thomas Jefferson supported vaccination, critics raised concerns about sanitation, religion, and science. The word anti-vax actually appeared in the early 1800s to describe hesitancy toward Jenner's vaccine. As governments began making vaccination mandatory in the 1800s, opposition grew stronger. In England, laws in 1853 and 1867 required infants and children to be vaccinated or face penalties. Groups like the Anti-Vaccination League and Anti-Compulsory Vaccination League formed to oppose these laws. In the United States, similar groups appeared, like the Anti-Vaccination Society of America in 1879 and the Anti-Vaccination League of New York City in 1885. A key legal case in 1902 in Massachusetts shows the ethical debates at play. A man named Henning Jacobson challenged a $5 fine for refusing smallpox vaccination. He argued that forcing vaccination violated personal liberty. The case went to the Supreme Court, which upheld the government's authority to protect public health but also highlighted the tension between individual rights and collective safety. Many groups supported anti-vaccine views. Some believed in bodily autonomy, saying people should decide what happens to their own bodies. Others, like homeopaths and naturopaths, saw vaccination as government overreach. Abolitionists, child safety advocates, and animal rights supporters also opposed mandates, viewing them as excessive control. These early roots show that anti-vaccine sentiment was not just about ignorance or conspiracy theories. It was driven by genuine ethical concerns about personal rights, government power, and medical freedom. The debates centered on balancing individual liberty with protecting everyone's health. Today's discussions about mandatory vaccinations still echo these concerns. The principles of respect for autonomy, justice, beneficence, and non-maleficence are at the heart of these debates. Understanding where these ideas came from helps us see that vaccine hesitancy is part of a long history of questions about how societies should protect health without infringing on personal freedoms.